Welcome to another episode of Med Madness, your go-to podcast for essential medical knowledge. Today, we're diving into a critical topic, amniotic fluid embolism, or AFE. This condition, though rare, is a catastrophic obstetric emergency that every medical student and professional should be well versed in. Understanding AFE is crucial as it can mean the difference between life and death during labour and delivery. In this episode, we'll explore what AFE is, its causes, symptoms, diagnostic methods, and treatment options, and we'll wrap up with a real-world case study to tie everything together. Next, let's discuss what this condition is. Amniotic fluid embolism occurs when amniotic fluid enters the maternal bloodstream, leading to a severe and rapid systemic reaction. This event can initiate a massive anaphylactoid response, resulting in widespread inflammation and coagulation abnormalities. Common risk factors for AFE include advanced maternal age, having had 5 or more pregnancies, caesarean or instrumental delivery, placenta previa or abruption, and preeclampsia. When amniotic fluid breaches the maternal circulation, it triggers the release of vasoactive substances and cytokines, causing intense pulmonary vasoconstriction and systemic inflammation. This reaction manifests as a sudden onset of hypoxemia, hypotension, and disseminated intravascular coagulation, or DIC. Next, let's talk about the symptoms and clinical presentation. Patients with AFE typically present with a dramatic and rapid onset of symptoms. These include sudden hypertension, tachycardia, and signs of shock. Respiratory distress is common, with hypoxemic respiratory failure leading to increased respiratory rate and decreased oxygen saturation. Neurological symptoms can also appear swiftly, ranging from confusion and agitation to seizures or coma. Another hallmark of AFE is DIC, characterized by persistent bleeding at IV sites and other puncture points. Additionally, the uterus may become tense and painful, and fetal distress is often evident through heart rate decelerations. Now, let's move on to how AFE is diagnosed. Diagnosing AFE requires a high index of suspicion and prompt action. Clinical presentation is key as the condition progresses rapidly. Coagulation studies are essential to confirm DIC, with abnormal results indicating the onset of coagulopathy. Other diagnostic tools include imaging studies to rule out other causes of respiratory distress and shock, such as pulmonary embolism or placental abruption. Early recognition and confirmation of the diagnosis are crucial for initiating life-saving interventions. Now let's discuss the management and treatment of AFE. Management of AFE focuses on stabilizing the mother and ensuring the best possible outcome for both mother and baby. Respiratory support, including oxygen supplementation, intubation, and mechanical ventilation, is often necessary to address hypoxemia. Hemodynamic support with vasopressors helps maintain blood pressure and perfusion. Given the high risk of severe bleeding due to DIC, massive blood product transfusion is often required to correct coagulopathy. Immediate delivery of the infant is crucial, especially in the presence of fetal distress. Despite aggressive treatment, the prognosis remains guarded, with high maternal and neonatal morbidity and mortality rates. Next, let's consider a case study to illustrate these points. A 32-year-old woman, gravida 5, para 4, was in active labour when she experienced an artificial rupture of membranes. Shortly thereafter, she developed sudden severe pain, anxiety, and rapidly worsening hypertension and tachycardia. Her oxygen saturation dropped, and fetal heart rate monitoring revealed significant decelerations. The clinical team quickly recognized these signs as indicative of AFE. Coagulation studies confirmed DIC, and the patient received immediate respiratory and hemodynamic support. A massive transfusion protocol was initiated to manage her coagulopathy, and the baby was delivered promptly via emergency caesarean section. Both mother and baby required intensive care but ultimately recovered, thanks to the swift recognition and intervention. Finally, let's wrap up with some key takeaways. Amniotic fluid embolism is a rare but devastating condition that requires immediate recognition and aggressive management. Early diagnosis and treatment are paramount to improving outcomes for both mother and baby. As you continue your studies, remember the importance of understanding conditions like AFE that can arise suddenly and escalate quickly. Engage with our pre- and post-podcast quizzes and utilise the Anki flashcards to reinforce your learning. Stay prepared, stay informed, and together let's make a difference in maternal and fetal healthcare. Thank you for listening to Med Madness. Until next time, keep learning and stay curious.